When we cough, our body tries to clean our airways, such as bronchi and lungs, from mucus and microbes, but sometimes cough is so severe that coughing itself becomes a problem, and we will talk about 5 most common causes of severe coughing. First most common cause is acute bronchitis. Acute bronchitis means bronchi becomes inflamed and irritated. And acute bronchitis usually is caused by viruses such as common cold, influenza virus, or coronavirus. Usually it's viral infection, sometimes can be bacterial. Acute bronchitis usually improves within 2 weeks. That's the course of disease. And it starts as a dry cough, becomes wet over time with phlegm and with mucus, and coughing worsens nighttime, and it can be severe barking like cough or hacking cough. Hacking cough means that there is very dry, repetitive cough. It sounds like a forced cleaning of the throat, and usually it's after infection period. So it's this hacking cough usually during recovery period, while during acute phase of bronchitis there is barking cough, especially in children. And barking cough is bark-like cough. It's seal bark, not dog bark. So acute bronchitis is first and most common cause of coughing. What is the treatment? Honey is considered very evidenced and natural treatment of cough, especially children after the age of 1. Honey is not recommended strongly and strictly is not recommended before the age of 1 because of risk of infection. So after 1 year, honey is best treatment for coughing. Also from medications, during dry cough, dexmedetomidine is most evidenced medication for dry cough, and it's OTC medication. For wet cough, bromhexine is very well known and effective. Acetylcysteine also, and ambroxol also, and guanfacine also is very effective and well known medication of coughing. So they are most commonly reported in recommendations and guidelines. But usually acute bronchitis coughing will recover completely and itself within 2 weeks. Second most common cause of coughing is pneumonia. Pneumonia means infection and inflammation of lungs. Pneumonia usually is bacterial infection. Bronchitis usually are viral infection. Pneumonia is bacterial infection. Although usually pneumonia starts as viral infection, and when viruses damage lung tissue, then it becomes a bacterial infection because this place inflamed tissue of lungs becomes a very comfortable area to grow bacteria. That's why bacterial pneumonia is very common. It is caused by Streptococcus pneumonia in most cases, and it can be dangerous and life-threatening in people after the age of 65 and in children. And cough usually is with phlegm, in this case with mucus, and mucus can be green or yellow or sometimes bloody, and person sweating and shaking, chills, fever is common also, shortness of breath, and general condition of patients is not good at this case. He feels weak, difficulty breathing, even on smallest exercise or smallest physical exertion. Person reveals difficulty breathing and dyspnea. Sometimes even person is resting, he feels difficulty breathing. It strongly indicates pneumonia. And what is the treatment of pneumonia? If it's bacterial infection, and in most cases it's bacterial infection, broad spectrum antibiotics are used, such as azithromycin or doxycycline, or amoxicillin with clavulinate. They are most commonly used drugs for empirically used drugs for pneumonia. If this pneumonia is viral, then antiviral medications is used sometimes, and symptomatic treatment is enough in most cases in case of viral pneumonia. Third most common causes of cough is pertussis. Pertussis, also known as whooping cough, and pertussis is well known because it causes very severe coughing attacks. It's very severe coughing, and patient releases whooping like sound after coughing, during coughing, when tries to inhale air. That's why it is called whooping cough. It's very severe. Initially, at first 2 weeks, whooping cough or pertussis looks like mild common cold. There is mild fever, there is sore throat, there is runny nose, nothing special, nothing important. But after second week, usually, or sometimes after 2 weeks, there is paroxysmal stage, and coughing becomes very severe, and at the end, with a high-pitched whoop sound, is upon the taking a breath. So whooping cough is very specific disease. It is caused by bacterial infection. This whooping cough is common in people who is not vaccinated on pertussis. So pertussis vaccination is important to avoid whooping cough. It's bacterial infection, and treatment is antibiotics. Treatment of whooping cough is azithromycin, erythromycin, clarithromycin. So antibiotics are treatment of whooping cough, and a vaccine also protects. It's very important. Usually cough medications is not effective for whooping cough. That's why it's very severe, and it gives very huge discomfort to patients. That's why important vaccination, especially for young children. It's very severe coughing disorder. And first most common cause of cough is chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease is gradual damage of bronchi and alveoli, which are the part of a main functional unit of our lungs, and it usually happens in people who are smoker and after 50 usually, and such people has chronic cough, and this cough is productive with sputum and phlegm, and especially it's very intensive during the morning. And what is the treatment at this case? Treatment is short-acting and long-acting bronchodilators, inhaled dilators usually, such as salbutamol, for example, and salmeterol also, and inhaled corticosteroids also important and part of chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease previously was named as a chronic bronchitis and emphysema. There was two different diseases, emphysema and chronic bronchitis, and nowadays we have one umbrella term which is called chronic obstructive pulmonary disease, which unifies these two conditions. And asthma is fifth most common cause of chronic cough. Asthma is very important disorder also because it's transient narrowing and inflammation of airways, but it causes very severe cough sometimes, and sometimes this coughing lasts for months if it's not treated adequately. That's why asthma is very important disease. Asthma attacks is highly associated with allergens. That's how we can differentiate with other types of cough. Person is allergic usually, and asthma attack starts when person comes to contact with allergens such as dust, for example, or cold or exercise. So it's asthma attacks. And asthma can occur at any age, but usually it's in young people. But of course there are also adult onset asthma also. And treatment is almost same, which is in case of chronic obstructive pulmonary disease or COPD. There is short-acting beta agonists, bronchodilators such as salbutamol, salmeterol, long-acting beta agonists. They are beta-2 agonists, of course, and also combination of corticosteroids. These bronchodilators plus corticosteroids, inhaled corticosteroids, are standard treatment, such as beclomethasone, for example, budesonide, for example, fluticasone, and leukotriene receptor antagonists also are used in combination with these above mentioned drugs, such as montelukast is a leukotriene antagonist. So we reviewed 5 most common causes of cough. First most common cause is acute bronchitis. So if person is coughing severely, first we think about bronchitis. In most cases it's bronchitis. Sometimes if there is more severe symptoms, if person feels ill, if person has high fever or chills and weakness and dyspnea, it can be pneumonia. If there is very specific whooping cough, it can be pertussis, but it's rare in vaccinated individuals. And if there is person who has chronic cough and he's smoking history and older already, then it can be chronic obstructive pulmonary disease. And if person has triggered coughing attacks, which is chronic in nature, it can be asthma. That's all. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.